Welcome to today's NCLEX Question A Day episode. A nurse is teaching a staff seminar on patient confidentiality. Which of the following statements would be included in the presentation? A. Verbal consent is sufficient to allow family members to see a patient's medical records. B. If a family member is at the hospital, he or she would be entitled to an update on the patient's status. C. All hospital staff may have access to a patient's medical records. D. Consent to disclosure is implied when a patient is transferred from one health provider or facility to another. Answer is D. Consent to disclosure is implied when a patient is transferred from one health provider or facility to another. Consent to disclosure is implied in the transfer from one health provider to another for continuity of care under HIPAA laws as long as the facility members receiving the patient health information, or PHI, are directly involved in the care of the patient. Consent must be in writing from the patient to allow the family members to see the patient's medical record or receive information from care providers. Updates on the patient's status should only be given with consent from the patient. This includes all family members, even a spouse. Under HIPAA laws, only staff operating in the direct care of the patient are allowed access to a patient's medical records. Thanks for listening to this episode of NCLEX Question A Day. Please like, share and comment this video. See you again tomorrow with another question for NCLEX.